Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Yeah, this is next week. It's August, and National Minority Donor Awareness Month is something that we started in 1996 as a day, and now it's become a month. And so it's important for us to do as many activities as we can to observe, making sure that people are aware that donation is a wonderful gift that can be shared. And there's many many infograms that are available in Spanish and English. And I think one of the things that we want to be sure to emphasize is that close to 60% of the people on waiting for transplants are minorities, and therefore the more people who donate, the more people of our ethnic group who are helped. So as a consequence of these kinds of efforts, we have tripled the number of African American donors and doubled the number of minority donors. So this is something that we're very proud of, and we hope that this month is. That's interesting. I didn't know that was it. This month will be even better than the months of the past, and that's just to tell you that they have a name honor in my name that they choose every year. Anyway, any comments about this month that's coming up that we're highlighting the importance of people of color being part of the equation? I just came back from Birmingham, Alabama, where the Transplant Olympics took place. And the beauty of that is that all participants in transplant, from the patients themselves to their caretakers, the professional transplant people, to the donors, the recipients, and their families, are all part of this Olympics, and they compete for gold, silver, and bronze medals. So it's a love fest in which all participants in transplantation are there, and they show love for one another. And it's one of the great experiences of my lifetime is to see all those people together for one cause, to show love for each other. Any comments or any questions about anything that I've mentioned? Okay, or we can go to the next one then, if there's no comment.
Speaking of Olympics.
Yeah, this is an incredible article that emphasizes the importance of living kidney donation. You can see that the current wait for organs is about 4 years for kidneys, shorter for livers and lungs and hearts. But for a living donor, if you get a donor, whether it's a relative or not, or stranger or whatever, it probably takes about 6 weeks to get things together. And so also the results of living donor transplants are best that we have. Deceased donors do well, but living donors do even better. And also add to that the fact that you don't have to wait for so long. So that this is a wonderful article that shows that You don't have to be a relative. You just have to care and love, and you can save somebody's life. And this is something that we need to do more of over the last 10 years. There's been no increase in living donation rates. And as a matter of fact, in African Americans, the rate has dropped. So that one of our efforts as part of MOTEP is to emphasize the importance of living donation as a way of moving forward, whether it's as a relative or as a friend or as a stranger, doesn't matter. And some would argue that you have two kidneys, that you can give one away. Anyway, this is something that this Olympic story highlights how beautiful it is that two Olympic gold winning um, persons can become part of the organ transplant story.
Dr. Callender,
Yes.
I was wondering how rigorous is the match situation? Is it blood type or is it HLA matching?
Well, actually, for kidneys, the best match, of course, is blood match is important, and HLA match, but you don't have to have a perfect match. In this case, they had a good match, but I think our first transplant had 1 out of 6 antigen matches and lived for 17 years. So that having the same blood type or a compatible blood type is desirable, and having a good match is great. But we even now can do transplants across blood type incompatibilities, which we couldn't do before, but we can do now. So getting a match, and then if it's got a good match for one person, it can be for another, and that's why we have exchange donations that can be transferred from one incompatible person to another. But anyway, answer your question is that the blood type is desirable, but not mandatory. They have processes, so even if you're a different blood type, you could be a donor.
Thanks.
Any other comments or questions? But this is a very wonderful story that, and of course, ethnicity is irrelevant as well. Whether you're what ethnic group you are is irrelevant. The match is more important than anything else, but even that is flexible. That comment about loving Mexican food more now from the Mexican donor is something that people always talk about. The fact that sometimes that when you get a donor from a person of color, you might love music more than before, and those kinds of anecdotes. Whether they're true or not is another story. But it's passed around often. Anyway, that's a great story, and it's opportunity to emphasize how relatively safe it is to be an organ donor. We've done multiple years of experience with almost every country in the world, and the safety record is excellent. Okay, if there's no more comment, we'll go to the next one. But this is a very timely article as we approach National Donor Awareness Month. Donation and living donors becomes a
And also approaching the Olympics as well.
yeah, right. That's right. Yeah, because they start on what, Friday. The ceremony opens on Friday. Yeah, so what's tomorrow? Yeah. It's been interesting that Global Tech Outreach, which it's been devastating. It's disrupted almost everything. And airlines, as well as, well, every aspect has been disrupted by the cybersecurity issue. There's no area that is untouched. And it's something that is disrupting every aspect of our lives. And question is, what are we going to do about it? That's the question of the day, because it's cost billions of dollars, as you can see. And I don't know any aspect of our lives that has not been disrupted by the IT issues. Has it impacted any of you out there? I know it's impacted physicians and in the medical profession and of course, people who fly know well. And the article in the Washington Post had people from many countries, all of them complaining about the IT outage rather. 5.4 billion in revenues and profit that's lost, and only 10 to 20% covered by insurance policies. Well, it's interesting. You trade one thing for another, and when you go into high tech, this is one of the downsides of it.
Well, the company where my wife works, their computer systems were down for a day and a half. So she was off work for a day and a half.
Wow.
She still got paid, so it was all a blessing.
Oh, she still gets paid. Oh, that's good. Yeah. Well,
In other countries, it was pretty devastating as well. I know in the Philippines, the internet speed was like almost dial-up modem speed, like 0.2 megabits per second at some points. Thousands of flights were canceled. And the reason that I included this, even though it affects so many, is that it affected hospitals.
oh yeah.
So people were, in surgery or whatever, and getting information from across the country or across the world, couldn't get it.
Right.
Really, really a bad deal.
Yeah. 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 Well, it's interesting that somebody's profiting from this. So that's the downside of it. And when they do these things, they try to extort money for doing it, for restoring some of it. But well, I don't know the answer. I know that every organization I know of is trying to introduce cybersecurity methods that prevent this from happening. But you wonder if it can attack Microsoft and the federal government, and who is safe from it.
I guess Apple, it might be safe. But it's really ironic too. I just watched this movie on the plane coming back, 16-hour flight. I watched this movie called The Beekeeper. Jason Statham,
Yeah.
and it was about people who
Take
were,
advantage.
yeah, were victims of cyber criminals.
Right.
And
And they took great delight in it, didn't they?
man, it's disgusting. That's how I felt. Disgusting. And the extent of it, I mean, these people were making millions of dollars every single day off of people who you know, uh, a screen would come up saying that your computer has a virus, and do not try to restart your computer because it'll kill all your data. And that's how they get in. They say, well, call this number, and as soon as you call that number, they got you. And they
Well,
ask you.
they don't have you unless you listen to them and pay attention to them. The moral of the story is that when they attack people who are over 65 who aren't as comfortable addressing this issue, actually, the truth of the matter is if you uh, uh, refuse to interact with them, then you're better off. But they frighten you, as you said, because they tell you if you turn it off, your whole system will be corrupted, which is not the case, but that's what they get you to believe. And then, as you mentioned, that lady who gave away $2 million killed herself, and, this is the kind of thing that may be happening every day, and people like us are taken advantage of and lose every penny that they have, and it's what was so bad about it, as you mentioned, is they took such glee in taking money from those people.
It was very high tech, very well organized, and uh, it's all across. It wasn't. This movie was about a company in the United States, but the the same thing's happening all over the world.
Yeah, yeah. And it led to the president.
Even more scary. Got all the way up to the very top.
Yeah.
And we must keep that in mind as we're going into this unprecedented election season.
Yeah. Yeah.
And they're going to take out all the stops for this Black woman.
Yeah, it's going to be interesting.
Yeah, I remember my mom was a victim of a company that took advantage of her. She gave them her bank account information, and they told her that they would, help her pay her bills because she was struggling financially. And I mean, she gave them her password and everything. And this is before I was aware of it, when she had Alzheimer's, and this was early on. She was very much afraid of being in debt, and it got so bad that she wasn't paying her utilities even. So she thought that these people were going to pay all her bills, and they did not. So I had to call them and let them know that we would let the Better Business Bureau know that they were taking advantage of elderly people. And I mean, they were taking out like $700 a month out out of her bank account, directly out of her bank account.
Wow.
Yeah. So, luckily, caught it early, and they actually stopped doing what they were doing. You have to change your passwords, off early and often.
How did you happen to find out about it?
Well, when the gas company told me that the bill hadn't been paid, she thought that they were going to pay all her bills, and the electric company called, you're a month behind, and that's what we had to do. We had to follow up with this company, and it sounded like a reputable company, and they prey on the elderly. I think she was like 75 or 76 years old. Maybe, no, maybe a little bit older than that. Maybe 80, 82, something like that. But she was afraid, and they took advantage of that fear.
Yeah. Okay, any other comments? Because this is something we're all subject to. Okay, let's go to the next one. It's interesting that we talk about cancer, and we talk about meat, and we talk about many things, but pesticides that used to for food as well, plant foods and all other foods, is as damaging as smoking, and that's one of the reasons why we recognize that cancer is occurring, not only because of many other things, but the food we eat and the fact that the pesticides that they use, as you can see in the leukemia, Hodgkin's, bladder, colon, lung cancer, are contributed to these pesticides that we use to protect our agriculture. And this agriculture protection exposes us to cancerogenic materials. And that's one of the reasons why people talk more about organic products that are free from pesticides. These days, they're hard to come by.
I had a question.
Yes.
I had a question for Darryl, since he's the organic expert. It just seems to me, I don't know if I'm wrong or not, but it seems to me that organic veggies and fruits don't last as long without spoiling as the other ones that have, I guess, pesticides or something's different about organic. They don't seem to last as long. I don't know. Is that true, Darryl?
Yes.
So you have to get them and eat them right away.
Right.
But when you
Yeah.
eat conventional, you don't last as long.
That's a very interesting way of putting it. Yeah. So
I saw the movie, They're Trying to Kill Us, from
yeah,
that outstanding presentation we had. It's very well done. And the young man comes from Wake Forest, where my daughter went to. Chris Paul, a friend of my daughter's, and I was so proud of what they did with that movie. And thank you so much for the presentation that we had. I learned so much.
yeah, that was one-of-a-kind presentation. We're fortunate to have Dr. Bowman. Yeah. So any of you who missed it, you can, Darryl is send it around so we can see it. Those who missed it, you want to see it. It's can't miss kind of presentation. Any other comments about this? Darryl phrased it well.
One other comment is that, yeah, organic foods are safer than conventional, but in a lot of cases, there'll be an organic farm that's located right next to a conventional farm, and you'll get the water runoff with pesticides that goes into the organic field. Uh, and you get, they're talking about airborne pesticides, that the air will drift into the organic field. And so it is safer, but not entirely safe. American food is the cheapest in the world, but also the most dangerous food in the world. If you want to be sure, grow your own, start a garden. Don't use pesticides.
Thank you for that comment. Any other comments?
If you don't use pesticides, don't the bugs eat your food before you can eat it?
They don't eat it all. So let's see. I've it's called your waste. With using pesticides, you get very little crop waste because the bugs don't eat it. But natural farming, you do have waste. If you're supposed, it's a matter of your yield. If you've got 80 bushels of corn, use pesticides, you'll get you yield the 80 bushels, but without pesticides, you may yield only 60 bushels. But that's the way it's supposed to be. You're not supposed to get 100% yield.
And there are pesticides, like I have started. Definitely my garden, which is on my deck, is not enough to even feed a family myself, but I get additional good food. It tastes different. It's a lot of work, and I'm not growing that many things, but one thing that I use early is neem oil, which is I was told a natural pesticide that can be used up until the day of harvest. And I was surprised at how using this preventively and throughout the course of growing my vegetables, that it was very effective. Are you
Another approach.
familiar with neem oil? NEEM oil.
Haven't heard about that. Yeah, gardening is a lot of work. You can take some of the work out of it by community gardening. So you can do some internet searches, community organic gardening near me.
Yes, I use Neiman oil. I'm familiar with it. Good morning again, everyone.
Yeah, I was going to say, Darryl had mentioned that when you do get food, regardless of what kind of food it is, to rinse it off in fresh water. And that gets rid of some of the invasive chemicals. Isn't that right, Darryl?
Yeah, the thicker the skin of the fruit, the less likely the pesticides are to get in, or vegetables. So, like, say, for instance, tomatoes, the skin is pretty thin, so the pesticides will get all the way in to the fruit. Bananas, skin is thick, So it's safer to eat a conventional banana than other fruits and vegetables just because of the thick skin. But you do need to wash it off.
Any other comments? If not, let's go on to the next one. This is an interesting article in terms of scientists alleging they've identified the root cause of lupus, which is an autoimmune disease, which particularly affects Black women, but it affects males as well. And what they have identified is that a certain type of T cell predominates, and that is why you have lupus. They allege, of course, this is one of the first studies, and time will tell whether this is a fact or not. Talking about type 2 interferon results in blocking the immune system, which then results in lupus erythematosus, which is a disease that affects almost every organ in the body. And it has been the causation of mortality and morbidity in many people of color. Whether this will turn out to be the actual root cause remains to be seen. This is the first article that really identifies this particular association of way of blocking. And this is, again, another situation in which we have inhibition of the body's immune protection by our own system, where we have substances that are preventing our immune system from protecting us. And as a consequence, we have these so-called autoimmune diseases, which are caused by the lack of our immune system to function. And this dysfunction results in disease production and illnesses like lupus erythematosus. And there are a number of autoimmune diseases. And we have treatments for them, but they aren't always effective. Any comments? Anybody who has lupus or any of these autoimmune diseases? I've had a number of colleagues of mine who died from lupus erythematosus.
I had quite a few. I've never had a male patient with lupus, but in late adolescence, it's a point at which it peaks. And I'm seeing many of the young women that I had the honor of treating that transitioned with lupus, and you know, its impact on women is tremendous.
It's interesting, yeah, because as I think back, I don't recall any males who I treated with lupus either. Okay, next article. The one thing that I would say about that is that this antibody production that we're using for this lupus is the same thing they're using for cancer therapy. And that's a relatively new concept that identifies these so-called blocking antibodies that prevent your immune system from protecting you. And these autoantibodies then actually kill you. When in point of fact, your immune system is there and is capable of protecting you, but these blocking substances prevent them from doing so.
Yeah, I was going to ask Doc, could you name some of the other autoimmune diseases that I thought, is it Lyme disease? Is that an autoimmune disease as well?
No,
No?
no, no. That's caused by a tick. But rheumatoid arthritis is a good example of autoimmune disease.
Sarcoid.
What'd you say, Lucy?
Sarcoid.
Yeah,
Sarcoid.
sarcoid, which is very common among us, is another autoimmune disease. The thyroid diseases, which are autoimmune. Many think that multiple sclerosis may be an autoimmune disease as well. So those are just a few of the autoimmune diseases that result from our own immune system being blocked from protecting us. And that's why in the treatment of these autoimmune diseases, you'll often find that they use steroids to knock out these so-called blocking antibodies.
So would cancers, different cancers also be considered like that as well?
There's a lot of controversy about that, but yes, because the immunotherapy that we use actually knocks out those inhibiting factors. So in many ways, some cancers are actually fit into that category, although we don't consider them as an autoimmune disease in many ways. The fact that cancer cells are allowed to exist makes it in many ways, despite the controversy, fit into the equation, because the cure for many of these cancers is administering compounds would knock out these blocking factors. But in general, they do not consider cancer as an autoimmune disease, but in many ways, it kind of fits the description.
It's become a first line of treatment for many cancers because it is not doesn't have such a deleterious effect on the body like Optivoy, Uravoy, using what this group has talked about so much, using the natural body to fortify and fight off the cancerous cells. So conceptually, that's the attack.
And that's why when we talk about the ways of preventing cancer, in addition to diet, is exercise and the other aspects of it, because a healthy immune system is one of the best protections against cancer. Any other questions or comments? Let's go to the next article. This is an interesting article. It talks about money breaks the record for the hottest day ever on Earth. Interesting that even in Antarctica it was warm. Only difference is for Antarctica, what is warm may not be considered warm for other places. But apparently there was a time when that hottest day ever on Earth. Of course, last week we had some of the hottest days around, but I don't know that for us here in DC it was particularly hot, but around the world it was. And this is all part of the so-called global warming phenomenon. We are finally acknowledging. Question is, are we doing enough to change that? And the answer probably is not, is no.
And
Anyway,
again, this article, it speaks to how very, very important we must be engaged moving into this next election, where the other, and I hate to make that distinction, but the others want to continue with fossil fuel, continue. At his Republican rally, he said, drill, drill, drill. All the things that we know are killing the planet. And so it is very, 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 very important that we not allow our government to go in the opposite direction, but must maintain its position as an international leader as it relates to global warming. It is too important. And 2025, Project 2025 points to the devastation that would be left if we continue down the path that was outlined by the Republican Party in Project 2025.
well, sometimes people forget that so many people die when it gets hot like that because everybody doesn't have air conditioning. And the homeless and the people who don't have air conditioning suffer. Kidney disease and liver disease gets worse because of the heat. And so it becomes critical to reverse the tradition we have of not recognizing that we are going the opposite direction. We're getting hotter and hotter instead of cooling off. Any other comments?
And it has to get to a tipping point. I remember when my children were very young and they were doing their projects and no paper and recycling and all of that. We've got to get to the tipping point that we're all there. Because the heating of the planet has gone much quicker than we even expected. And a decade ago, we thought it was horrific.
I remember when Gore first started talking about it. Nobody listened to him. Now we're paying the price.
And it's destroying many, the impact. Yes, we don't have air conditioning here, and it's some discomfort, but it's causing mass migration of people because of flooding, because of the impact that it's now had, erosion of of rivers and oceans, and it's so important. And it's at a point where we individually have to change what we're doing.
Okay. Next article. Well, this is an article that we've talked about on many occasions. And the Darryl is probably one of the few who has been talking about this for about a decade now, about how cold showers are good for you. And this is not new, but it's a most recent article on it. And you see once a year, they running out into the cold water to demonstrate that cold showers are healthy. But although that is the allegation, how many of us actually take cold showers? Other than Darryl, anybody else take cold showers?
Well, when I was in college and in the summertime, we were in those dorms that did not have air conditioning. We took cold showers
Mm.
to cool off.
Darryl, any comment on this?
Of course. Yeah, it talks about mental and heart health later on in the article. But as far as like how it can make you feel as long as you acclimate yourself, like they say, folks don't go from 0 to 60 in cold showers; they have to work up to them. Um, and it's best to have a transition to go from lukewarm water before you go all the way cold. And just a few seconds of cold water is better than a cup of coffee or caffeine. It can wake you up, give you a lot of energy, make you feel perky, make you feel like king or queen of the world.
Yeah.
Of course, you can overdo anything. You there was a thought that cold therapy, cryotherapy, was a secret to longevity. That if you got up to 5 minutes of a cold shower three to 4 times a week, that it could make you younger, that it could increase the length of your cell telomeres, and so that you'd be actually biologically younger. And but it's pot. Okay, there's some dangers with if you have any heart type of problems, you probably should avoid that shock to your system that could give you atrial arrhythmia, could lead to AFib. So you have to make sure that if you have heart problems, like AFib patients, should avoid cold showers. Um, uh, some brief, like say a splash of cold water on your face. If somebody is in AFib, it can restore some sinus rhythm, but you don't want to have an extended shock to your system if you're a heart patient.
I've always wondered about the athletes who get in those ice baths. Is that the same type of thing, or is that extreme?
Well, it's okay. What sets up the heart condition is not necessarily the um, the ice baths. That's for recovery after extreme events. But what they're finding is that endurance athletes and professional athletes are much more likely to have AFib. So things like marathon runners, triathletes, professional athletes, there's quite a few of them that have AFib later in life when they get in their 50s and 60s and 70s, like Larry Bird, Kareem Abdul-Jabbar. Uh, they're all AFib patients. They're managing it, controlling it with either procedures like ablations or with medication, dofetilide, Coumadin, blood thinners. Um, but that is one of the consequences of if you're an endurance athlete, you're overdoing it. And there's if you're a professional athlete, if you're an Olympic athlete, you're overdoing it for a long time. And overdoing anything can have effects on your heart. I wouldn't encourage any of my grandnieces, nephews to get into extreme sports. Football, get the head injuries. I wouldn't. I'd tell people don't be a marathon runner like me. I ran 18 marathons. It's too risky. Don't be a mountain climber. You could put your heart at risk.
Yeah, interesting. Of course, the number of people who climb mountains and do those things still is unchanged. So some people just feel that they must do those things. If you say you can't do it, they want to prove that you can.
But you can get the encouragement, if they hear, well, is it really worth the risk to be a Kareem Abdul-Jabbar and have to manage your AFib or a Larry Bird? Sometimes with fame and all the thrill, there comes some consequences. So,
Yeah.
it's like nobody tried to talk me out of stuff. I wish they had a.
Well, look at you, man. Look at those guys. Kareem is alive to have AFib, and Larry Bird's alive to have AFib.
Well,
That's
if
it.
Kareem Abdul-Jabbar had a do-over, um, we may have never known about Kareem Abdul-Jabbar. He may have not had the fame because, you know, uh, good, long, healthy life is worth far more than any fame or thrill that you might uh, be enamored with as a youngster.
Any other comment on this interesting discussion? Okay, let's go to the next one.
Oh, just before we do that, I know there's some polar bear clubs. You know about them? They
Yeah,
they meet in the winter
right.
and jump in, but that's an event. That's not a regular. I don't think it's a regular part of someone's program, athletic program. But are there records of people having issues when they jump in that cold water, heart attacks, strokes, things like that? The polar bear
I
swimmers.
haven't seen any data on that. You, Darryl?
No, I haven't seen any data.
Yeah. So, and you'd think if they did have it, that you'd see it, but I haven't seen any data on that. And those clubs still exist. Every winter they show us running into the cold ocean.
Yeah, they got them in Chicago.
Oh, they do. Wow.
Yeah.
Hmm. Well, okay, let's go to the next one. This is an interesting one that talks about Paxlovid, and it's good in that it talks about what Paxlovid is for and what you cannot take when you have Paxlovid. One of the things about Paxlovid, it is good for COVID, uh, but there are certain conditions which contraindicate your being able to take it. And there are certain medications that you have to stop if you're going to take Paxlovid. And also, of course, if you have kidney disease, you can't take Paxlovid. Uh, so Paxlovid is a very good treatment for COVID, but it also has its limitations. And most of the recommendations is that if you get COVID, then within 5 days you have to take it, or else you miss the opportunity. Uh, and there's a long list of medications that you just cannot take if you have Paxlovid. And the side effects of Paxlovid are listed here as well. I don't know how many of you have had Paxlovid. because it's a treatment for COVID, especially if you don't have a contraindication to take it.
I've had it twice.
Any problems with taking it?
No, the typical ones, the taste. But you think it's not a big deal, but it's annoying. But I'm alive to talk about it.
Yeah. Okay, any comments or questions? And it's interesting that very few people that here have actually taken Paxlovid. As we know, there's a uptake in COVID this summer. As a matter of fact, in my choir I sing in, I think there's been at least 6 cases of COVID. So that COVID is awakening again. And now, as a matter of fact, we sing Sunday and they are recommending that everybody come with masks. So,
Yeah,
how about any of you in your churches? Are you going back to masks?
well, I just wanted to comment about the mask situation. So I flew to Hong Kong, and you would really be shocked to see out of maybe 500 people, maybe 5 people had masks on.
Yeah,
It's very shocking. I had mine on the whole time except when I'm eating. So yeah, I think that even though we have the vaccines now, which pretty much protect us against dying from COVID, which is a really big deal because that was the fear at first. And several family members got COVID and passed away as a result of COVID early on. But yeah, Paxlovid can kill the virus, which is that's what we didn't have before. We didn't have that ability to kill the virus. You had to treat the symptoms.
Any other comment about this life-saving medicine?
Not about the medicine, but as we're seeing some of the preventative strategies that we use, I think we need to look at again. One of the things that I thought was very, very important was that when you're sick, stay home and don't expose other people to you. And from the standpoint of employment, that was appreciated and the appropriate measures were taken in terms of, you don't have to bring in documentation that you were seen by somebody. When you're sick, stay home and don't expose other people to it. And I think now that's changed. And I would like to see us go back to that type of mentality.
That's in all of our best interest.
Yep. But greed, financial greed is
Yeah.
something that jumps right in there. 1, 2, 3.
Yeah.
What about thou shalt not? I remember seeing this this billboard that said, "What about thou shalt not that you don't understand?" And I just fear that we'll return to that horrible behavior.
Well, it's interesting that our church is now really going back to the mask situation. And almost everyone now in the church will have a mask. So it's interesting. I don't know about other churches, but I know our church. But that's because so many people in the church have come down with COVID. Okay, let's go
I
to the
think I'm going to wear my mask when I go back to church. I think you know, it's got to start with me, huh?
yeah. Yeah. Yeah.
Actually, that's the last article, though.
Okay. Um, actually, I sent many articles to John, but I guess he didn't include them. So to John Tatum. And since you were away, I didn't include you on them. So uh, any other topics that you think we ought to discuss? It's good to have those of you who are here. Any
Good
other?
morning, everybody. Glad to be back. On the last article about COVID, uh, I guess I'm still in the COVID mode. I stay home. I order groceries. I go out as little as possible. And fortunately, I'm able to do that. But there's so many other people who aren't fortunate enough to do that. They have to go out. But I'm still in that mode of, it's something out there. So I'm home more often than I'm not home.
Okay. Well, one thing is clear is we're going to have to go back to the one thing that I think John Buchanan mentioned is that because most of us are vaccinated,
Yeah.
we don't get as sick as before. And as he mentioned, the likelihood of death from COVID isn't like it was before. But COVID is no fun. And wearing a mask is an ounce of prevention. So it's something when we go to public places that we must reconsider, especially if you go on airplanes or public transportation. Or you go to basketball games, baseball games, those kind. Baseball
Wow.
games are different because it's outside.
Concerts also,
Yeah, concerts as well.
especially indoor
Yeah, especially.
concerts. And one of the most dangerous parts of those is the egress, in and out of a concert where you have that crush of people close together.
Yeah,
That 6 feet distance that our buddy recommended is no longer in effect.
yeah. I think most people have done away with everything except I hope the washing of hands remains and the masks remain. So I think that's important to continue because the numbers are going up for COVID all across the country. Okay.
And whatever happens, or unfortunately, we have seen, and they haven't institutionalized equity in that arena. So whatever we're seeing, we're going to get it worse. And so from this discussion, I'm really going to ramp it up. as it relates to my mask wearing. Um, I think there was once or twice, because I get on myself, that I came in and the first thing I did was not wash my hands. But I have got to be diligent. We know the truth, we know the light, and we owe it. I know I owe it to you for sharing these articles and the insight and the transparency of everybody on this phone call. I have to be a disciple and spread what I know. And we have to take these steps. It's been a hot summer, but we're getting ready to go into the fall. We come inside and we have to be disciples of this knowledge.
Let me remind you that next week we're having Robin Williams, Dr. Robin Williams, who's going to talk to us about breast cancer. She's a breast cancer expert who's been doing breast cancer surgery for the last close to 20 years, and she's going to talk with us next Thursday about breast cancer. So we're delighted to have Dr. Robin Williams with us, and look forward to her sharing with us her expertise.